Hello, this is Bob LeBeau, physical therapist with Body Gears Physical Therapy.
And I'm Rebecca Johnson. I'm also a physical therapist working with Body Gears Physical Therapy.
In this episode of Body Gears Masterclass, we're just going to do a basic screen. I'm going to break it up into upper quarter screen and lower quarter screen on a different module. This is something we would do after postural assessment, after a gait assessment. We're just going to clear the upper quarter to see if there's any problems coming from any parts. So if the patient has neck or upper thoracic pain, we still want to look at shoulder, elbow, upper cervical spine, lower thoracic. So it's just a basic screen, get really good at it, get quick. What we're trying to do is limit our incidence of missing important things. And we get a good idea of what's going on. Again, it's not an examination, not everything's in here, it's just a very quick screen. So first what we're going to do is we're going to ask her to go through cervical range of motion. Rebecca, go ahead and turn your head to the left. So we ask, any discomfort there? If there's no discomfort, we go ahead and put a little bit of pressure and do a little over pressure. My arm, on the right arm here, is blocking her shoulder, and we're going to hit a little bit of a stretch to see what it feels like at end of range. Any trouble there? Okay,
Just tightness.
I'm going to go through a little faster, a little more real time. So we're going to do one side and the other. Turn your head to this side. Good. And a little over pressure. Good. Any problem there?
Just
So
tightness.
after rotation, we're going to go ahead and flexion. Go ahead and flex down. Any problem there? Then I'm going to take my hand and just do a little bit of pressure. I'm going to hold with the opposite hand at the top of the thoracic and flex down. Any problem there?
Nope.
Good. So after flexion goes extension. We go up toward the ceiling. I'm going to take my finger like such, put it under her chin very gently, and extend back. Any problem there? So that's both flexion and extension for the mid-cervical spine. If you want to look at upper cervical spine flexion, jut your chin forward, please. Like this. And we're just jutting the chin out. Go ahead and turn yourself a little bit so the camera can see it. There you go. Thank you. Back. And then lower cervical is tuck your chin in like this. I'm going to come from the opposite side so you guys can see this. My hand is like an ice cream cup, ice cream cone, and we're going to just flex the upper cervical spine and hinge over the hand here. I like to have my patient at the edge of the table. You go ahead and back in, because I can easily go from side to side, making it more efficient. So after flexion and extension and rotation, we'll look at side flexion. So in side flexion, I'll have you bring your head to the side. Any problem there? I'm going to use this part of my hand, the thinner border of my hand, at the upper. I'm going to look at upper, middle, and lower, giving a little overpressure for all of those. And then, of course, repeat it on the other side. If I don't find any significant pain, the likelihood of cervical spine starts to go down. If they're having some symptoms in the arm, I'll add a Sperling's test, which is simply side flex away and compress down through the spine. So this is called a Sperling A. A Sperling B is simply the same with a little bit of rotation. So this is almost a cervical quadrant. You're compressing the cervical spine, lower cervical spine, to see if you have any trouble on the arm. Now back I said that this is a screening procedure, but sometimes I like to rule out the neck with a Lysol Sperling's test. Not necessarily the exam, but still on the screening side. So again, we've done rotation, extension, flexion, side bending, and a little bit of special test with a Sperling. Next I like to do is cervical or shoulder. So raise your arm up. So this is shoulder flexion with overpressure, which is also called a Neers. I like to bring them down into a Hawkins-Kennedy and an adduction test, just to see what the shoulder feels like. Is it stiff? Is it limited? Does it produce their pain? The next thing I'll do is have you put your hand behind your head. Same position. I'm going to gently hold the hand with the palm with my hand. I'm going to extend her laterally or externally rotate her and adductor. Adduct back to the center. Does that produce any discomfort? The next thing on that is internal rotation. We do external rotation, hand behind back. So internal rotation. I'm going to put my hand just like this, a gentle soft grip. I'm going to bring her arm behind it, back. So we're going to internally rotate, adduct, and extend. So go ahead and face that way, please. I'm going to show it. Perfect. Let me see if I can get a good picture. So bring your arm back. So we're going to come back. We're going to adduct, internally rotate, and extend. This puts a lot of pressure on that shoulder. And if the shoulder is not complaining, you're in great shape. Come on, back to the front. So after the shoulder and neck, we're going to look at elbow. So just easily bend your elbow up. We're going to put a little over pressure. Now, when you go down, you want to hold the elbow here like this. You could also do it like this. Put your arm in front and just hold gently behind the distal end of the humerus, and you get a little over pressure. You could bias it with a little medial and lateral glide if you're not finding anything and you're curious. You could also do the same with this, medial or lateral and medial positioning. Wrist, very simple, flexion down, flexion up with overpressure. You could also do radial and ulnar deviation, very, very easy. Thoracic spine gets a little more interesting. Let's go ahead and turn toward me. So thoracic spine, you're going to look at flexion. So recommend put your hands above your head like this, like you're doing a sit-up. So let me have it come from this side. So with flexion, we're going to simply flex down and put a little extra pressure here. I'm going to bias upper, middle, and lower. Now extension is very similar. You doing okay with your hand position? Your hand behind your neck with this one. A lot of patients will extend the neck. We've already cleared that, but I want to just make sure. So I'm going to do extension, upper, middle, and lower. So that's extension and flexion. So we have rotation, so cross your arms a bit. So rotation could be upper and lower as well. So we could get a nice grip here and twist her to the right. Any problem there? You give a little over pressure. Excellent. Come toward me. And we're just handling nice and easy. Good. Now for a lower, we'll do the same position. We'll flex down and twist this way and twist the opposite way. Good. So the last thing to do for this screen is thoracic side flexion. Let's sit straight there. This one, you have your patient bring the hands up like such and ask permission. Is it okay if I put my hand through your arm?
Yep.
So I'm going to reach in and around, so you just let the patient know what's going on. You gently bring your arm in and across to the opposite side. This hand on the right is going to block the upper thoracic. We're going to side flex this way, and that way, and that way. Good. Let's do that at the other side. Again, patient's comfortable on the ground always, so they're not guarding. Their feet are on the ground there. The hand sneaks through, weaves through, hold on to the opposite side. This hand just gently cups the thoracic spine, flex, and side flex. Good. Now after screening, you want to go on to myotomal assessment sensation as needed. This is a great upper quarter screen. If something is uncomfortable, it warrants further examination. So if the shoulder was more uncomfortable, we'll look for shoulder-specific examination and special tests to rule in and rule out pathology and focus our treatment at that area. Oftentimes, cervical spine will refer to the shoulder and neck, or thoracic spine will give a little bit of interest into the conditions, especially in the arm and extremity. That test should just give you an idea, I may need to go back and examine it further. We'll talk about the examinations of specific joints in further videos. Thank you.